Good morning. It's Friday. Friday. It's National Senior Citizens Day, which for me is just another day at work. Oh. So for while many are celebrating Friday and the beginning of weekend, it is my work week. So I start today. Yay. That's why we call it Friday. Let me pull it up on the big screen. Hey, Bobby. I am here. I actually slept good last night. Slept probably almost 8 full hours. Oh, gosh. And how was Bobby on Friday? Chloe B just got my application submitted for spring nursing program. I'm nervous. Yeah, but excited at the same time. Congratulations. Yeah. No, I have until 6:37 to clock in. Oh yeah, I'm backwards. Well, I'm backwards for many reasons, but because I haven't flipped the screen, you have to it's defaulted to be backwards. Oh, see, I got my new shirt. Classically trained. No late, bad on a Friday too. Bobby slept good finally. Chloe B, thanks for the Care Bears. Ooh, we're out of creamer. It's like the sweetened cream, so I had to just do like milk and sugar. It's not the same. I like the sweet cream. All right, good morning. Welcome in. Are you in the parking lot? Because I know you're working like every day until you start school. I'm up. I'm up. Amanda Danelle, everybody's rolling in today. We got a lot of songs to get through. Planet Oat Creamer is the best. I don't know if I know that one. I put brown sugar and half in my coffee. Ooh, that sounds pretty good actually. I could do that. Just need to get out of bed. No, I don't get out of bed. Yes, you have to. We're adults. Legally, we're adults. Do we behave like adults? Maybe not. Bobby. I think Bobby was here first. I think it was Megan, then Ari, then Amanda. No school or work today for Amanda to now. Whoop whoop. What are you gonna do with all that free time today? Bobby says there's a Red Sox game tonight. I mean, like, it's baseball season. They only get like 2 days off a month, which is kinda crazy, but they get paid a lot of money, so I don't feel bad for them. Alright, so apparently I have to try the Planet Oat Creamer because it's the best. I'll have to look to see if we even have that. Where do you get that from? Because sometimes they have the regional things. Ari? No, we don't have a Whole Foods. Chloe says, "Same day off school and work. We just won tickets to a concert tonight." Oh, that's a good day. Yeah, we have a Walmart. I try to avoid the Walmart if I can help it. It's just total chaos, like, all the time. Now and we've got college kids back in town, everything's gonna be nuts. Do I think it's hard for EVS to advance? Um, maybe? In healthcare? I mean, I guess you could move up the ranks, like, in terms of, like, management for EVS. It just depends on what hospital system you work for. But I think management would be the way to go. Alyssa Marie, I start my 4th semester of RT school Monday, finally getting my student license next month. Oh, very cool. I didn't even know they did a student license. We don't have that in nursing school. Are you in the US? Alright, you can do a transition program to RN at my school for EMS. So when see, I hear EVS. EVS for me is environmental services. But if you're talking about EMS, no, I think that's a fairly easy to advance. Different department like CT or something. Again, what do we when we say EVS, what do you mean EVS? I think that can mean different things for different people. Okay, we do have Kroger, so I'll have to check it at Kroger. Alyssa Marie, yes, we have nurse externs in a lot of hospitals, which is just PCAs that go to class. Interesting. But again, like, what does EVS stand for? Is it environmental services, like housekeeping, janitorial stuff? Ah, yes, the new nursing specialty. The new nursing specialty, on June 17th of this year, the American Nurse Association Board of Directors recognized patient blood management, or PBM, nursing as a nursing specialty, approved a scope of practice, and acknowledged its standards and competencies. And it's the fifth specialty the ANA has recognized since 2020 and the second in 2026. And they will have a certification test that you'll be able to take. So there you go. And that is from nurse.org, which is a great resource for news. Yesterday was National Bacon Day, and I'm really sorry that we missed that. Let's see, birthdays today. I think it was Kim Cattrall's birthday. Yes, Kim Cattrall, Usain Bolt, Casey Musgraves. I think isn't she like a country singer or something? I don't know. Don't know much about her. Patient blood management nurse. What it do? I don't know. It manages blood. Let's see. I'm trying to look to see what they do. In practical terms, that means PBM nursing is now an officially recognized specialty with a scope and standards documented defining blah blah blah. I don't know. It doesn't really explain what it is they do. No idea. Society for the Advancement of Patient Blood Management. Ah, here we go. If the role is unfamiliar, which it is, the work probably is not. They work in hospitals, clinics, and outpatient care centers. Patient blood management nurses, according to Johnson and Johnson Nursing, they screen and treat anemia, coordinate care across surgical and hematology services, contribute to transfusion policies and guidelines, teach patients and staff how to protect blood health, and work to minimize blood loss. Okay. Well, good for them. If that's what you do for a living, now you can get a certification for it. Like I have one for emergency nursing. It's so they can make nurses do labs all at night. Bleh. I've always wondered what do we get wondered who do we get our blood type from? Your parents. What do you think is the coolest nursing department? The emergency department. It's not even a contest. Now, I may be biased. Holly, good morning. Welcome in. How have you been? Bobby says I was way off. Yeah, I have no idea what they do. I don't think I've ever come across a nurse who works in that field. I mean, I give blood all the time. Good morning, Helen. Are you adjunct? Yes, I am adjunct again. My clinicals I think don't start till mid-October, so mid-October to mid-November It's only 4 clinicals this semester. They just made them longer. We used to have 5 nine-hour clinicals, and now they're like 4 10.5-hour clinicals. But it is 10 minutes from my house. Instead of driving 30 minutes or an hour away, it's literally at the hospital I started my career at. So I'm kind of like, I'm jazzed about that. I know that facility a little bit better and it's really close. So getting up early will not be as difficult for me. Shelly, I work at a hospital. I feel you guys do more than the doctors do sometimes. It's probably because we spend more time at the bedside than doctors do because we don't have as many patients. The doctors often have way more patients than we do. So they can't afford to spend as much time at the bedside as we do. So that's probably why you see. And we do more of the tasks than doctors do. Doctors see the patient. Occasionally we'll do bedside procedures, but for the most part, nurses do most of that. Yes, I have worked in the ICU. I started my career in an ICU, medical surgical. Helen says, awesome. And they were awesome with my students back in the day. Cool. The encourager, if my VP shunt broke off and is in my pelvis, that's not good, right? That's correct. That's not good. And that's needs to be addressed immediately. Did you have to have orientation at the hospital before you teach clinical? No, that's the thing that I told them was very strange. And when we had our conference last week, I said, "Look, the first time I go there is the day I have clinical. Like, there's no orientation, there's no get to know the staff." I said, "We need a day, at least one day, where we can meet the staff, meet the managers, not just show up on the first day of clinical and be like, 'Hey, I have students today.'" Sometimes they know and sometimes they don't. And I think there's a lack of communication. But it was good because we had the administrators for those hospitals there, so they're aware of that. Now, because I have previous connections there, I might go ahead and reach out and see if I can do that on my own. I won't get paid for that, but at least I'll have an idea of what's going on. Travis says, would you suggest people in nursing school to work in the ER as a CNA? If the ER has CNAs, I've not worked in an ER that employs CNAs. CNAs, I think, typically are on inpatient floors. We have techs that work in the ER. Dana Scully, good morning. Welcome in. Helen says that changed. I had to have some hours on the unit before I took students. That is wild. Yeah, I know. I agree. And that was my comment to them is like, we need orientation. Now, when I was in nursing school, we had to do that. We had to go to like a 2-day thing where we had to learn, we had to do like basic bloodborne pathogen modules, and we had to go through like a tutorial on how to use the charting system. Now, my students aren't charting. They're not getting in the computer yet. They're learning basic bedside stuff. Dana, thanks for the Go Popular. I appreciate that. And the Gare Bears. I got a notification that my fan club had unlocked the Gare Bears. I didn't know we had that. So now you can give those, which is really cool. Paramedic to RN John Smith. Good morning, sir. Happy belated anniversary to you and your lovely wife. I saw your posts. She looked a little skeptical of of what you were doing, like, "What are you doing?" And you were like, "Happy anniversary." If you don't follow Paramedic to RN John Smith, especially all you nursing students, paramedic students, EMT students, you should go follow him. He does a ton of great educational information, and he's also a hell of a barbecue smoke pit guy, which I like. I don't know what time the trial starts today. We can look it up, though. I hear the defense is gonna rest pretty soon, although I think the judge sent the jury home again yesterday for unknown reasons, so I'm not sure what's going on. Let's see, what time does the Clancy trial start today? It starts at 9 AM Eastern. Yeah, she doesn't make many appearances. Yeah, my wife makes 0 appearances. She does not wanna be on social media. So, you will never see her on my social media, and that is at her request, and I honor that request. I also there are certain things that she doesn't want me to talk about, so I don't talk about those things. The Megan Marshall says, "Help! What am I missing?" And don't you order a damn CT either. I know that post I did was funny. Oh no, a spider. Reminds me of that song. Gary, you got to turn around. If I have a medical issue, it feels like medical is being medical. Do you think I need Look, if you're gonna medical right, and make sure you get the medicine for the medical stuff. Oh, come on, Megan. Like I've seen you like you can handle a spider. You're way bigger than it. Aiden, I sat next to a mother whose kids had a bloody nose for 5 minutes after a fall, took kid to the ER and then urgent care. 5 minutes? I mean, with the fall though, with the head injury, that's probably a valid concern. The encourager, my doc didn't mention it to me, had to find out on my chart. Oh wait, what did they not mention to you? I gotta scroll back and look now. Now I'm curious. Bear with me, folks. I'm catching up. Do you think ER nurses should be able to tell people they're wasting everyone's time? No. I mean, there's definitely times that you feel like you want to say that, but no, we shouldn't say that. That we would lose trust in from the public because if somebody else overheard us saying that and they were there for legitimate reasons, they might not come the next time because they're afraid of being judged. So no, we should not be able to say that. You can think it, and sometimes we do. There are times when people come there that don't need to be there, but that's not for us to determine. We have to do our due diligence and make sure everything's okay. All right, I'm still looking. The encourager, my doc looked at my torso X-ray and didn't mention it. Oh my gosh, I got to go back again. Doc looked at my torso, didn't mention it. Had to find out. Oh, your VP shunt. Yeah, that's really strange that they would not notice that because I'm fairly certain those are all radio opaque. They should have noticed that. Aside from studying, what is the best way to not fail nursing school? Um, I would say getting in with the wrong crowd, and I don't mean that like I mean the people that are not gonna help you study because it's hard to get through nursing school by yourself. Like, you really gotta have a solid group, a small group of people that can help you study. Sometimes they understand concepts better than you, and when they explain it, it makes more sense than what happened in the classroom. And then don't go out and party as much or at all. Maybe a little bit, but you need to focus on your studies. Mr. Clean, good morning, sir. Happy Friday to you. El Massey's in the house. God, we need somebody named Timmy to come in here because I've got that sound ready to go. Country time, a little early for country music. El Massey's music. Well, I'm sure country music's coming up. I try I tried to add Garth Brooks, but he doesn't let his music on Apple, man. That's not my bad. A good Charlotte song? Yeah, I like Good Charlotte. I think I've got them in the rotation. Ta-da! I just like I have to fight that urge. Like I have patience every now and then. Once in a blue moon, whose name is Timmy. It's Timothy or Tim, and I just like in my head. For adults, 30s, 40s going back for nursing school, is it harder? Yes and no. I was 38 when I went back. So I was 38 when I went back, 41 when I graduated. It was hard because you have more responsibility. The stakes, I think, are higher. At least I felt they were. I left a job to go to nursing school. And I, did this with the blessing of my wife. We talked about it. We had to plan for it. And, you know, I I already had I already had 1 kid from a previous marriage, so that situation, I still had to, pay child support. I still had bills to pay, and now all of a sudden I'm leaving a job. It wasn't a great job, but it still paid the bills. So there was that stress of you can't fail. Like there is zero room for error here. You cannot F this up. And so from that standpoint, there was a lot of pressure and a lot of stress. It was different when you're younger, there's different stresses that I didn't have to deal with. The social anxiety, peer pressure, all that kind of stuff. I did not have to deal with any of that. Caleb, what song plays in your head when Alpha Trauma gets called? Trying to think. I don't know. That's a good question. If I had to have a theme song for that, Mole the Merciless circus music. Dun, 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 dun. Yeah, that's accurate. What about academically? What are the struggles? Um, I would say the for me, I'm older. So when I was in college the first time, I didn't have a computer. The only people that had computers were engineers and architects. They were required, and they were very rudimentary computers by today's standards. Your cell phone has more computing power than those things did. So I would say for me, I had stayed up to date on computer technology and all that. I wrote some basic code, not anything complex, but I could write basic code. I could design websites using HTML and JavaScript. So I had a basic understanding of how all that stuff worked, which I think helped me. But I think if you come from a world where you didn't use computers, that is everything in nursing school. They don't even have physical textbooks anymore. I went to nursing school, we still had textbooks, but they don't now. I think a lot of nursing schools have gone to this digital book, and I don't like that at all. I need to be able to highlight, dog ear, like I need a physical book. It would be very difficult for me to understand and comprehend topics in a book if I can't write in that. And I would always write. I rarely sold in nursing school. I never sold my books back. In my first round, at the end of the semester, I took those books straight back to the bookstore and sold them back. I need a physical book. I don't know how college kids do that this day. I think the other challenge is AI. Students are using AI to write their papers, to get answers, and I think that's a slippery slope. I think that's dangerous in terms of being a competent nurse. If you are getting through nursing school relying on that, and they have technologies to try to detect if you're using AI in your papers. I know I had to use, Grammarly. We had a Grammarly account through the school. Now Grammarly will actually, as you type your paper, you can add, like a what do you call it? An extension, and it'll actually be like, "Hey, this sounds AI," or, "Here's an AI check," that doesn't sound like AI wrote it. And that's what they're gonna have to do is try to detect who's using AI. What can someone do with TMJ pain? I mean, anti-inflammatories, but oh, Ricky duh Bobby. Dude, you're just a nurse. Calm down. I will not calm down. Whatever. Thanks for commenting. You're a little nurse. You're not a doctor. Oh, Ricky, did you come in here thinking you were going to make me feel bad about myself today? No, man. You're going to have to try way harder than that. But thank you for commenting. Thank you for engaging. Clean the house and do some laundry. I do those things too because I'm not a complete asshole. So, but I can tell by the way you're commenting, you sound like that you would expect a woman to do all the work for you. Okay. You're cute, Ricky. You're so cute. You're probably homophobe too, aren't you? Don't even block him. Let him let him keep talking because the more he talks, the dumber he sounds. Shows. Do you watch on TV? Are they all doctor shows? No, I don't. I don't really watch that stuff. I know you really want to. No, let him go. He's just one of these. Oh, Bobby couldn't take it anymore. Bobby's like, "I have had enough of that." Jew says, "Thank you. I'm in my 30s, starting pre-health this September. Hopefully, Bachelor of Science in Nursing next year. I did bad in high school." Yeah, but that was high school. You were a different person then. I mean, I'm not the same person I was in high school. Not many of us are. You have life experience. You've learned. Hopefully, you've learned lessons, and we'll take it more seriously. What are some main symptoms of a stroke? So the things that we teach general public and like even my kids, I have taught them this because like one of my fears is having a stroke. So we teach the FAST acronym, face, arm, speech, and time. So if you see drooping on one side of the face, so like corner of the mouth starts drooping, the eye starts drooping, arm strength. So if you notice one arm is like they're not lifting one arm or it's kind of like dropping down like that, or they can't use it. Speech, if their speech is slurred or altered, if they're not making sense, we have what we call expressive aphasia, where like they're trying to speak, but the words are not coming out the way they want. And then time. Notice the time. When was the last time you saw them normal? So it's what we call last known well time. That is very important because that's going to give the neurologist and the ER teams a really good idea of what treatments are going to be available to them for the patient. So, and it's not when the symptoms started, it is when was the last time you saw them completely normal. And so that's where it gets kind of challenging. So, like, say, for example, your parent wakes up in the morning and they have these symptoms and it's 8 o'clock in the morning. That's not when the symptoms started by our calculation. If the last time you saw them normal was 9 o'clock the previous night, that's their last known well time, because we don't know at what point in the night those symptoms began. Be fast. I think we've gotten away from be fast because I think we've gone it was they found that it was too complicated of a acronym, so we were back to the fast, and we've dropped the BE. Asia, good morning, welcome in. You still in Jersey? Bobby's like, "You're out of here." That was funny. It's just weird, like, why would like, I don't understand the motivation for people to go into somebody's live and just be an agitator. Like, what do you get out of that? It's just weird. I don't understand that. I would never go into somebody's live and do that on intentionally. Odd question. This is from Ambrosia. Odd question. Are you no longer growing hair? No, I have to shave my head like every other day. In fact, it's a little scratchy. If you are, is it difficult to get a clean, close shave? Um, Yes and no. When I first started shaving my head about 7 years ago, I tried using a razor because I wanted that smooth shave, but I would cut myself too much. I've got this, like, little lip on the back of my skull, and I would cut myself, and a lot of men I've talked to that shave their head have done the same thing. It's just that where that the base of the skull comes back up, you catch it and you cut yourself. So I use an electric razor. I've actually used 2 different electric razors. I've got my Braun, which I've had for like 16 years. That thing is a beast. I love that thing. But the problem is it's straight. It's hard to do your whole head. So I did get one of those palm shavers with like the 7 blades or whatever, the spinning blades. That does a pretty good job, but it doesn't get as tight as I need. So when I do that, that takes about 5 minutes to get everything. And then I take the other one, the Braun, because that gets really close, like almost razor close. So the Braun actually works really well. Now they make like $150 scalp, like for bald guys. I'm not paying $150. I got like a $35 one off of Amazon and it seems to do fine. 5 seconds of fame, maybe. Power trips. Yeah, that's why they come on and do that. I don't know. 7 divorce 3. I don't know what that means, Cypress. You're often too clever for me. And I feel bad because I don't fully appreciate your jokes all the time. And I know they're clever. Aegis is back home in Delaware now. Sadly, I have to work tomorrow morning. Womp womp. Yeah, I'm working all weekend. Today, Saturday, Sunday. Although Sunday is my short day, so I get off at 6 o'clock. So that's good. I get my weekend started a little bit early and I get home before it's dark. For now, it's getting darker earlier. Yeah, I would never do that, but 7 AM already hating is crazy. It's like they woke up and chose violence today. Come on. I want my fame. You want fame? Put some creamer in your coffee. There you go. Famous or infamous? What are your thoughts on the accelerated MSN programs for people with no nursing background? Um, I don't know. Like, I don't know how long they are. I guess if they hit all the major things and they still have to take, I'm assuming they still take the NCLEX, right? We're talking about people that I've seen programs like that, and I think I looked into that, but I don't know. I felt like the BSN was probably the more appropriate for me. See, Dana has a MHA, Masters of Health Administration. Is that what that is? I assume. And thinking about going back to school for what? Colton says, Gary, you're a five, bro. Just got off my shift. Let's get the weekend started. Yeah, mine's starting today. But thanks for stopping by, Colton. We live stream every weekday morning at 6:30 right here on TikTok. We simulcast across a few other platforms, but most everything is here. Jen probably will not be here this morning. I think she is flying down to Florida to look at a house. And if they like it, I think they'll put an offer on it. Or I think they already have put an offer on it. I think they just want to see it in person. Hey, James 00. Thanks for the rose. I appreciate that. Dana says, oh, MSN. I've thought about doing that as well. As a clinical instructor, I get a certain number of free credits each semester. And so I've thought about like starting to take some of those MSN classes. Juice says, "Where are you from?" I'm new here. I'm in Virginia. Amanda Donnell, thank you very much for the Daily Heartbeat. I appreciate that. The acceleration to MSN is worrisome. I agree. I feel like it's not enough time. I feel like they condense it too much. And do they still have to do the same amount of clinical hours as a BSN student? I think about going back to school, but I'm like, I don't want to write papers again. Like I just loathe writing papers. Oh, you know what I started reading? I'm reading 2 books. I'm reading, Alexander Hamilton, the one that inspired the Broadway musical, Ron Chernow, and then I also finally I'd been on a wait list forever, was the, Howard Zinn, The History of the United States. I started reading that too. Let's go. Little BTS. I'm all in on the BTS now. Their music is catchy, and they can put on a show. I've not seen them in concert, but I've seen clips of their concerts, and I'm like, "Dang." I mean, they really go all out. They had to take a break because they have mandatory military service in South Korea, and so one of their at least one of their members had not done theirs, so they had to go do theirs, and so they kinda took a hiatus, but they're back now. What's the best way to stitch a 4-inch laceration from a serrated blade? Asking for a friend. Right, asking for a friend. You need to go to the hospital, or you don't have to go to the ER. A lot of urgent cares can do that, but they're gonna wanna know when your last tetanus shot was. If it's been more than 5 years, they're probably gonna recommend that you get a new tetanus shot. You probably heard it's every 10 years. Really just depends on what happens after 5 years. And the other thing is if it looks infected, they may talk to you about doing some antibiotics, and also how deep it is. If it's superficial, then maybe some simple sutures will close it up. But if it's too deep, sometimes they've got to do layers of stitches to bring that subcutaneous tissue back together and then do the top. Because you want to do it by heal by primary intention, not secondary intention. Then you get like more scarring. Moldemers, what did Moldemers say? He always has some good stuff. Oh, you finished up the Henrietta Lacks book? Oh, that's great. The Immortal Life of Henrietta Lacks, another great read. I have like now I've got like seriously, I'm not even joking. I have 10 books that I'm currently reading. I also hate A. Franklin RN. I also hate writing papers. How many ways can you say the same thing without plagiarizing? I know. Haley, we have 2 full days of class, 1 full day of lab, and 1 full day of clinical per week. For what kind of program? Did I miss that? I need more info. Now I can suture. No, I only do, like, simple sutures. I don't do any of the complex mattress sutures and all that kinda stuff. I practice those, but I can't do those. Oh, 7 7 Mary 3 Reverend. See? Like, right over my head. Now I get it. That's funny. Sorry, man. I feel like your good jokes are wasted on me. Nurses can, in certain cases, do that. It depends on your facility. Suturing. Like, in some hospitals, nurses can do EJs, external jugular, and some they don't. Some hospitals, they may allow nurses to intubate in certain like, in the ER setting, some don't. It depends on the hospital policy. What are your opinions on staples versus stitches versus glue? So staples typically are in the ER setting are only going to be on the scalp. We don't suture the scalp. So if you have a scalp laceration, there's not enough tissue to do that effectively. And so we have very specific they basically a surgical staple gun. It looks exactly like a staple gun you would use in your garage. It's just like all white and it is sterilized, comes in a sterile package. And yeah, you pinch the skin together and like literally just like pull it together and then you ka-chunk, ka-chunk, and it makes the same sound. Now you try to numb it up as best you can. Sometimes they don't. Sometimes they just like this is gonna hurt. Ka-chunk, ka-chunk. Sutures, the usually gonna be like the ones that we see, fingers, hands, arms, legs, those kind of things. And then glue is an effective tool. Like what we use Dermabond, and that's going to be an effective tool for very well approximated, meaning the edges come together really nice. And then we will put steri strips to help hold the skin together. We'll put that oh gosh, I can never remember the name of it. What's that stuff that you put on to make it stickier? Help me out here. They come in those little vials, plastic vials. You crack it. It's like a glow stick. You crack it, and then you rub it on there, and it makes it benzoin. Is that what it is? Yes, I am Mastisol. That's what I think of. Mastisol. Yes, I am familiar with the history of super glue. It was an accidental discovery, and he left it there. And then when he came back, it was like solid. I was like, oh, let's see, super glue background. Invented by accident in 1942 by Dr. Harry Coover during World War II while searching for clear plastic gun sights. It was later rediscovered and marketed commercially in 1958. It was tested acrylite formulas for airplane gun sights, but found them too sticky and useless. Years later, 1951, Coover tested it again for heat resistant jet canopy coatings, realizing it bonded everything instantly without heat. Marketed first as Eastman 910 before becoming the household super glue. Interesting. I knew it was an accidental discovery. But yeah, Mastisol is the one that I always think of. Now the stuff you can get over the counter, the liquid Band-Aid, that stuff burns. Like, I don't know what it is about it, but it burns. I've tried that, I will not use that again. It's a lot different than what we use in the ER. Read The House of God, 1976. It's about public hospital, very dark, but nothing has changed. Oh, interesting. I have to write let me write that down. Books. House of God, 1976. I gotta finish the ones that I'm reading. Because the History of the United States by Howard Zinn is a long book. So is, Alexander Hamilton. The McKesson Dermabond swabs are goated. Oh, I've not heard of those. Oh, is that why liquid Band-Aid is alcohol-based adhesive? Ugh. You know, that reminds me, we get a lot of older today is National Senior Citizens Day, by the way. The thing is, older patients, they often stick to the things they learned when they were kids or when they were younger, like they love to put alcohol in wounds. They love to put hydrogen peroxide in wounds, and you just got to keep like you got to re-educate them. Don't do that. Things have changed. We don't recommend that anymore. It's not good for the healing, so it actually can cause more damage. So, gentle soap and water. That's all you need. Still prefer staples overall for deep cuts. Oh, interesting. Yeah, we only do that for in the ER. We only do that. Now, I've seen abdominal surgeries, like open abdominal surgeries, come in. I've seen staples for that. But again, I work in the ER. We don't do surgeries in the ER. Staples typically are only going to be used on the scalp, but I have seen them in other places. Yes, after people have had extensive surgeries. The audiobook for House of God is good. I read that one for school. Oh, interesting. I love audiobooks because I've got a bit of a drive to work. So I'll just put on an audiobook and listen to it on the way to work. And I usually listen to it at like 1.5 speed so I can get through it a little faster. They read slow, which I get, but I need my brain works faster than that. Anthony Clark made it's amazing. The old Jewish patient has it down. Here I can complain. I had 20 Haley had 20 staples in my knee. Yes, I've seen that as well after having my meniscus reconstructed. Ouch. Who remembers the sign, like, if you're concerned about a meniscus tear, it's that they can't bend their knee, right? I feel like that's the test. What are you listening to? This is Third Eye Blind. Are you not familiar with Third Eye Blind? I think this is off their 1997 album. Most people don't know super glue needs to be stored in the fridge. Oh, I didn't know that. Is that true? Let us double check that. I did not know that. Does super glue need to be refrigerated? Let's see. This says no, it does not need to be refrigerated for everyday household use. Storing it in a cool, dry place like a drawer or cabinet between 50 and 70 Fahrenheit is ideal. Now, it does say when refrigeration is optional, unopened lifespan. Manufacturers design super glue to last 8 to 12 months at normal room temperature if unopened. And they also say keeping it chemicals near food items in the kitchen is generally discouraged. Woodworkers and hobbyists sometimes refrigerate or freeze unopened bottles of specialized super glue to extend its shelf life for several years. If you do this, you must follow strict rules. We won't go into those. But anyway, I think I don't know. It might have been something she heard, but no, I looked it up and it doesn't say that you have to refrigerate it. I got to scroll back. I haven't missed anybody, right? Did I get everybody's music? I think I got everybody's music, right? Uh, Iodine is still good for wounds. Um, we use betadine to clean wounds that are dirty before we do sutures and stuff like that. If it's a real dirty wound, but generally speaking, we don't use it for everything. That's betadine. Amanda Donnell, I had internal dissolvable staples and glue for my C-section. Yeah, that's dissolvable staples. That's cool. I didn't even know that you could have dissolvable staples. What are they made of? Now I got to look that up. What are dissolvable staples made of? I've heard of dissolvable sutures. All right, let's see here. Dissolvable or absorbable surgical staples are made from a synthetic bioabsorbable polymer, copolymers, primarily a combination of polylactic acid, PLA, which is I feel like that's the same type of plastic that I use in my 3D printing, and polyglycolic acid, PGA. These medical grade plastics break down safely inside the body through hydrolysis into harmless natural acids that the body can then metabolize. There you go. Learn something new today. Oh, the other thing I wanted to talk about. So, you know, the story in Nashville, Ascension St. Thomas, that somehow the pharmacy did something, made a mistake where medications were mislabeled, and that 72-year-old woman received a bolus of potassium chloride through her epidural. She was supposed to get bupivacaine, and now she's paralyzed from the chest down. So I wanted to look up, and I did. What is the mechanism of action there? Like, what happens when potassium chloride is pushed through an epidural? So I went to Open Evidence, and this is what I got when I asked. The question was, what happens if potassium chloride is accidentally delivered through an epidural? And the response was this: accidental epidural or intrathecal potassium chloride is a neurologic and cardiovascular emergency that classically produces severe injection site radicular pain, rapidly progressive motor and sensory blockade, paraplegia or tetraplegia, autonomic sympathetic hyperactivity, and can lead to respiratory failure with outcomes ranging from complete recovery to permanent paralysis. The high extracellular potassium concentration depolarizes neural tissue, and the hyperosmolar solution directly irritant to the cord, spinal cord, and nerve roots. So, typical clinical course in this onset is within minutes to a few hours. Severe pain and muscle spasms, cramps in the trunk and lower limbs at or below the injection level. Progressive motor and sensory block, ascending weakness, numbness, culminating in paraplegia or tetraplegia with high level involvement, sometimes with bladder and bowel incontinence, respiratory depression and failure, autonomic sympathetic surge, and cardiac involvement. So, I mean, it says the outcomes can vary widely. I assume age would be a role, the dose, obviously, a role. But in this case, it was permanent. And now they're saying up to 9 patients were affected. A couple are reportedly on ECMO now, and a couple more are in the ICU and in critical condition. So, this could get a lot worse, unfortunately. They had vid from the hood in the pharmacy. So I haven't seen that. They've released the video? I would think legally they would not do that because it's gonna be evidence in a trial for sure. Kiki's mom, I was literally about to ask. Yeah, I was really curious, like, what happens? Like, that's not something I ever would have thought to ask. PLA, yeah, PLA is a 3D printer. It's the same type polylactic acid is what most of my filament's made of. I do have other filament, PETG, which is more durable. I ordered some TPU, which you can print gaskets, like flexible gaskets. You can print shoes, like Crocs out of it. Is it true, y'all? Yeah, wire brushes. No, we don't use wire brushes. Dissolving stents are coming out. That's pretty cool. Like, are we talking about like heart stents, leg stents, DVT stents? You know, they've developed a technology where they can do a cabbage, a coronary artery bypass graft without open chest. How wild is that? It's in very specific cases, but they've already done at least one that I know of. Let's see, dissolvable stents? Those are also made of polylactic acid. They open clogged blood vessels and deliver healing medication before completely breaking down into water and carbon dioxide over 2 to 3 years, leaving the artery free to move and flex naturally. Interesting. I guess that kinda makes sense. I guess the concern when you place a metal stent is that it can also be a barrier and can allow blood to clot to it. Although they do use, the drug-eluting stents that have they're, like, coated with an anticoagulant that's supposed to prevent that from happening, as I understand it. Print me some Crocs. Oh my gosh, that to print a pair of Crocs, that would take a lot of PLA. A lot of PLA. I'm not PLA, TPU, I think is what it is. Not released, but reported the video via, law enforcement is from what I read. Oh, interesting. Yeah, how did it happen, though? That's a thing. Like, it wasn't just 1 patient, it was multiple patients. So, yeah, there's g you wonder if this was intentional. You hope it's not, but I don't know. What about wire hangers? Like, can I print wire hangers? Gordon got the elf. Hello, sir. Welcome in. How are things in Australia this evening? Mold and Merce. I was in Heartcath and the company rep was there, so I got to talk to him about it. Yeah, it is pretty cool. It would be Mommy Dearest reference. You guys talked about Wire Bride. Oh, gotcha. I don't think I've seen that movie, Mommy Dearest. Did you hear about the melanoma vaccine? I heard about that they've developed a mRNA cancer vaccine where they take the patient's tumor cells, program it, and then they develop a vaccine for that particular person. And I think the preliminary human trials have shown a significant reduction in recurrence in that cancer. So I think they're very promising. And then, of course, all I can think of is all the people like, I will never take an mRNA vaccine. Really? If we can cure cancer, if you have cancer and we can cure your cancer by using mRNA technology, you're not going to get it then? That's kind of weird. It's an old one. I'm familiar with it. Oh, that's the same one then, the melanoma vax. Oh, interesting. Yeah, but it's I mean, I read up on it and I was like, "That's really cool." Customized cancer vaccines. But you have to have it first. Like, you have to have the cancer so they can pull from it, program it, and then put it back in. Spider's still here. Well, your husband's gonna have to come home and take care of that. Otherwise, you're gonna have to move or burn it down. What's up with the new specialty? Yeah, we talked about this earlier. It's the patient blood management, PBM. And for the we tried to figure out we looked at the description. I've never met a nurse that does this specialty. It seems like a very, very specialized specialty. So they do transfusions, they educate, all the things dealing with blood products. He's working. Well, what's more important? Work or you? But you need to text him. You should take the text verbatim from that video and send it to him and see what he does. Oh, thoughts on synthetic blood products? I mean, I've learned about them, but I don't feel like I've never actually used any of that. Do we even still use those? I've learned about them, but I've never synthetic blood products. Yeah, they're not widely approved or marketed. I mean, if they can do that safely, sure, that would be awesome. Because right now there is a blood donation shortage in this country. So if you're able to donate blood, please go to the American Red Cross and donate some blood. Oh, Megan Marshall's gonna shack up with Amanda until that spider is dealt with. Rural EMS medic about a 2-year shelf life. Yeah, like I said, if they can get it approved, that'd be really cool. How would you like to be the human trial for that? Yeah, I'll take some synthetic blood. Sure, why not? I'm gonna go Monday or Tuesday of this week, next week, because I'm off those days. So while the kids are in school, there's a American Red Cross not too far away, like right here in town. You can schedule an appointment online, show up 30, 40 minutes, and you're done. I mean, if you want to sell plasma, man, there's some money in that. I think you can do that every 7 days, I think. Blood donation, whole blood donation is like basically every 2 months. It's every 52 days or 56 days, something like that. Now, I will say though, the plasma donation, that takes like an hour and a half to 2 hours. So you're gonna be there for a while. So bring a book. Plasma center closed. That's interesting because like there's a huge demand for that. Oh yeah, that's good. Get a vacuum cleaner with a long handle and just suck it up, and then throw the vacuum cleaner away. Just get a new one. It died. It won't work anymore. It's cheaper than a new house. I'll tell you that. Smarty Pants Nurse, good morning. Welcome in. I tried to say too many things at one time there. I'm not having a stroke, I promise. Cypress, try to get your dog to donate blood to vets or oh, yeah, it's true. That is very real. I thought that was gonna be a joke at first, but no, you're absolutely right. They always need because there's a vet hospital that does surgeries, and I'm sure they're always looking for blood. Now the question is, do dogs have blood types like we do? Now I gotta learn that too. See, we're just learning all kinds of things on a Friday. I would assume they do. Look at that. I typed "do dogs," and the first thing that came up says have blood types. Yes, they have multiple blood types. Canine blood types are classified using the dog erythrocyte antigen or DEA system. There are over 12 recognized blood groups in dogs, while the most clinically important being DEA1, which includes DEA 1.1 and 1.2, blah, blah, blah. 40% of dogs are DEA1 positive and 60% are DEA1 negative. Dogs that are DEA1 negative and are negative for other major markers are considered universal donors because their red blood cells are less likely to trigger severe immune reaction in recipient. Breeds like greyhounds, boxers, and German shepherds are frequently DEA1 negative, so that means they're universal donors. Unlike humans, dogs generally do not have a preformed natural antibody against other DEA types. This means dogs receiving its very first blood transfusion usually will not have an acute life-threatening reaction, even if the blood types do not match. Very interesting. So it's like Rh positive, right? We've gotten on to veterinary talk here. Now we have to see what species have the most common types. I think we just covered that. Greyhounds, German shepherds are two of them. Azaria Doll. I had my first interview as a graduate nurse for an ICU position today. Any advice? Oh, very cool. Um, First of all, congratulations on graduating, taking the NCLEX, passing your NCLEX, and getting your first job. That's awesome. It's a great feeling. I started my career in the ICU. When you go for your interview, I would say, acknowledge that you're a new grad and that you're not going to know everything, and that you look forward to learning and understand that you're going to learn a lot in yeah. And I think the other thing, from your perspective, I would ask them how long is their new grad orientation program. Hopefully, they're gonna bring you along because going straight to the ICU, and of course, I've never had a problem with going to the specialty you wanna be in, but that is a huge leap. You're taking care of critically ill patients as a new grad, and it takes 3 to 5 years to be considered and feel competent in what you're doing, and as a new grad myself, when I went into the ICU, I was terrified. Like, I'm taking care of vented patients. I remember I got my first balloon pump, and I mean, literally sweating, I was so nervous because that's a terrifying piece of equipment if you've never used it. Now, fortunately, I had really good, experienced ICU nurses who took me aside and taught me and showed me how to use things and gave me that confidence. And I knew they were there. I knew they had my back. So I think asking about that support is going to be important. Dana Scully, have a great day. Thanks for stopping by this morning. Possum Bone, veterinary ER ICU nurse here. Welcome in. Most of us have pets, so it's all kind of related, right? Mr. Clean is off to work. Have a great Friday. Thanks for stopping by this morning, sir. I have this is my little Aussie buddy. I have celiac disease, so my immune system attacks itself when I eat gluten. Yes, and that's awful. I'm sorry you have that. I would be devastated. There's so many things I wouldn't be able to eat anymore that I really love. What about yeah, oh, yeah, RTs were great. When I had to learn how to use ventilator, I still keep in touch with my RTs from my first job. They taught me so much. Now, not a lot I can do with a ventilator. I can pre-oxygenate before doing inline suctioning. I can silence the alarm until they get there. I can check for disconnections if it's alarming. I can go in there and do my dope mnemonic. But from a when I went to flight school, my goal was to be a flight nurse, and I knew I would have to learn how to use ventilators independently. So I would ask them tons of questions, lots of questions, and they were really good about it. And even today, I ask them lots of questions. In fact, I'm gonna do a piece, a short little educational video on, on a type of mask and how to use it. Bobby, he's gotta go. Have a wonderful day and weekend. Off to try another Lonnie. They're sweet, super sweet. Possum Bones, yes, my beagle and I were on the same med for joint pain. You guys can commiserate. That's pretty cool. So your sister is a human ER nurse, and we love chatting about work, even though it's different. And some of it's probably there are probably some similarities. What are your thoughts on male sane RNs? Do you think there is a need? Well, men are also victims of SA, so in that case, yeah, I think there's certainly a need. I think it would be challenging to convince a female who is a victim of SA to allow a male to do that exam. That's just my gut impression, right? Um, but I think there is probably some need. It's like having I don't know. And again, it would have to be up to the patient because if that's the only sane nurse available, then they may not feel comfortable with that. And so now you run the risk of not having an available resource. So am I still thinking about leaving bedside? Yeah, there's a position that is gonna be opening up that I am going to apply for that is not bedside. It's still in the ER, so I can still assist. I can, like, they're short-staffed, I would still be able to take patients and help them out, but my primary responsibility would be, um, like, the back end managing, um, follow-ups that occur, like, when a ER doc puts in a consult for another specialty, kind of following up on those patients. Because when we discharge a patient, part of our job is when we do our discharge packet that is computerized, there is a section that says, "Was there a consult placed?" You say yes. That automatically tags this nurse's position, so they get that notification. They've got to go and make sure those things happen. So they're really invaluable, and I'm sad that we're losing the nurse that works that position because she's been doing it for a long time and she's wonderful. Anything you need, even if she doesn't know it, she knows the people that will, and she will get you answers, and she is on it, and she's amazing. And so losing her is going to be a huge blow. But she has advocated that the replacement needs to come from the department, not an outside. So we'll see. When that job opens up, I will apply for that. I'm going for the same position. Good luck. I think I got this. Is sane usually full-time position, or would you work in the ER and rotate in and out as needed? It depends on your facility. Um, where I first started working many years ago, we did not have a sane nurse, but there was nearby hospital that did. So if we had a and we did have patients present, with that concern, and we would call the other hospital to make sure their sane nurse was on duty. So they were either on call or they already worked in the ER. I'm not sure how that works. I think it can be. I know, like in the pit, Dana, the charge nurse, is a sane nurse, so she was able to um, do all the collection with a victim. So yeah, it depends. Some staff them, some they're on call, some may be a regional thing. I apologize if I missed a comment. I'm not ignoring anybody on purpose. I'm sorry. I just sometimes I get to talking and then there's like 3 or 4 comments go by or more and I miss them. Moldamer says our sane nurse covers a certain region. Right. Yeah, that was a wild episode. I think they did a really good job of kind of capturing like of course I've never been a victim of that. I have no idea what that feels like. I can only imagine what that feels like. But I think it was a very uncomfortable scene, which I think is how it really would be. And, the fact that she wanted to quit several times, I think that's probably very realistic. I think they probably did their due diligence and interviewed people who have been through that or nurses who have administered those exams. And I think those are very real reactions. Am I an expert in giving enemas? An expert? I don't like to use that term. I don't consider myself an expert in anything. I have given a lot of enemas in my nursing career. I am proficient. Let's put it that way. I am proficient. I think every ER needs a Dana. I agree. I aspire to be a Dana, except getting punched in the face. I don't want to do that. Not the way she did. I've been punched, but not like that bad. Is that a credentialing that comes after being an RN? Yes. You have to be a registered nurse, and then you have to go through a credentialing process, an education program. I don't know what the specifics are, but yeah, you have to go through a training program and get certified. I know Shazam, we talked about that earlier. So from what I've heard, I think oh gosh, what's his name? The anesthesiologist, Nick, I think his name's Nick. No, Zach MD. He he said somebody was in touch with him, a trusted source. He said he didn't name the name, but he said I think 2 people are on ECMO, 2 more in the ICU, and of course the 72-year-old who is paralyzed from the chest down. I have a lot of questions, as most of us do. Oh yeah, someone's going to jail. I think for sure because there are medication errors, and then there's like that is really bad. And if you are I don't know, I just cannot imagine what happened that led to something this big. And apparently there's video available. It's not been released to the public, but there's video of what was going on under the hood, which I've never actually seen how medication is made. I've never been up to a pharmacy or in a pharmacy in a hospital where they make all these meds. But that's a good question for Little Pharma when I get her on a podcast, which by the way, I'm reaching out to her. Oh, and El Massey, I don't know if El Massey's still in here. I think she may have left. I think it was her, whoever sent the people to the form for the Slim Can. So I officially have the license to make Slim Can holders, 3D print them. Um, and I actually have 2 customers now. And those 2 customers alone will, if they buy, that will pay for the license for 1 month. It's only $10 a month. So potassium is the biggest issue as a nurse, but a pharmacist. I did hear about a story, somebody let potassium run to gravity because they did not have a pump and didn't know how to do the drip rate. So when I say you need to know how to do a drip rate manually, that's why. If you don't have a pump to run potassium, then I'm not running it. I need a pump. I'm not I'm, I'll find a pump. Shazam, have a cool day. 4 years retired. Oh, you are what I aspire to be, a retired nurse. I'm not rushing things. I just one day I'd like to be retired. I don't want to work until I'm 80. Yes, Megan, you're gonna get yours. I've gotta mail out a bunch. I have like 5 that I need to mail out. And I'm just gonna I ordered I did like I shipped Jen's and Amanda's I shipped in like padded envelopes, but I don't really like those. I'm worried that they're pretty durable, but I'd worry that something got would break it. So I've ordered boxes. They're like 6 by 4 by 3s. They'll fit, and it's like 7.69 at the post office. That's the cheapest ground shipping I can get. And then it costs so it literally comes out even to a $14, right? For the shipping. Shipping's all more than half of it. But the calculator for the supplies, it comes out to like 6 something bucks. What is a code blue? That is when somebody's in cardiac arrest. Their heart has stopped, and we are going to have to resuscitate them. Shazam traveled in the last 5 years and did a year at UVA. I was at UVA about 5, 6 years ago during COVID. Liz Effect, thanks for the Daily Harmony. Thanks for stopping by. Another fellow nurse, ICU nurse. She does regular DJ sessions. Go give her a follow if you like music. Shazam, were you in the ER? No, you weren't in the ER, were you? I feel like we've had this conversation, but I'm old and I forget shit. So Brandon says it's my first week of school. What's your best tip that will help me succeed? Find a good group of study partners, not friends necessarily, people that are going to help you succeed. Focus on your studies. Use Quizlet or Notebook LM or whatever that thing is that people use these days. Um, avoid AI. Don't let AI write your papers. They will get you. Ask questions. And the reason I say find a good study group because sometimes people understand things differently than you. Maybe you didn't understand a concept, they did. And so when you have these discussions, you're like, "Oh, that makes more sense." When you say it like that, now I get it. Sarah says, "Thank God my night shifts are over." Are you days now? Maddie says, "Study with a person you don't like as well as the people you do." I mean, I understand what you're saying. Like, you're gonna work with people that you don't have a choice, and they may not like you and you may not like them, but you gotta learn to get along. But if somebody can give you a different perspective and help you understand the concept better, that's ultimately what you want. You wanna come out of there knowing as much as you can. That's right. Yeah, you're gonna work with people you don't like. There are gonna be days you come in and you're gonna see the rundown, like the lineup of who's working. You're gonna be like, "Crap. Okay, gotta mentally prepare myself for this day." All right, folks, it's 7:45. That means it's time for me to get out of here. I've got to get kids ready for school. I get myself ready for work. It is the first of 3 in a row. So wish me luck. We will see you Monday morning for our regularly scheduled live. I take weekends off. I hope you all have a wonderful weekend. Be safe. If you're in the path of storms, take care. And as always, be kind to yourself, be kind to others, prioritize your mental health. I'm Gary the ER Nurse. Have a great weekend. We'll see you Monday morning, 6:30, right here on TikTok Live.